And welcome again to another edition of Expert Alert. I'm Jim Tabor, your host, and this morning we have back in the studio with us Sunny Elmer, who is with Integrated Medical over on Pass Road in Gulfport. Good morning to you, and good to have you here. And pretty soon y'all are going to be moving to a new location.
Yes.
Over on Pass Road in Biloxi, just to the east of Keystone Federal Credit Union. So anyway, how are you?
I'm doing well.
I'm doing good.
Yep.
We want to, enlighten people a little bit, kind of talk about some of the procedures that y'all do, in case this is the first time y'all have tuned into Expert Alert. But Integrated Medical, they basically can handle pretty much a good, except for surgeries.
Right. Soon we may be doing that too.
You might be doing that too, huh?
Yes,
You
sir.
never can tell. Well, give us a summation of a lot of the things that y'all do there.
Okay. We are family practice, but we're also doing regenerative medicine as well. So we're not your typical, you come in and we put you on a pill and something synthetic and just hope that you get better. We're geared towards fixing the problem and not just trying to
Put a Band-Aid on it.
Right. In some situations we can help it get better, but we're still, our focus goal is fixing the problems. So a lot of regenerative medicines will do that. We offer family medicine services as far as physicals go. Our nurse practitioner just received her license for doing DOT exams.
Oh, okay.
So if any truckers out there, anything like that, and companies need one, just give us a call and we'll get you in.
What do you do with a DOT exam? I mean, I had a commercial license years ago, so, and I'm sure they have some pretty higher expectations from truckers
They do.
than the average person.
Most companies will give them the paperwork to come in. It just requires a more extensive, making sure that your heart's good, that you're able to do prolonged periods of driving, that your vision is good. We go to...
Well, I failed already.
We go to the DMV and it's like, oh, look into the thing, and you just, yeah, you're good. But this is more of an extensive, you have to be eye exam and everything.
Having narcolepsy is not something that you that would
like if you're on sleep aids and stuff, that would be probably a no.
Now, as far as let's talk about, y'all do the COVID tests.
We do. We're still doing COVID testing. We are still waiting for our COVID injections because we'll be doing the vaccinations.
I got my first one, the Pfizer shot, about a week ago.
Right. We are seeing a lot less testing because more people are doing their part and getting the vaccinations. So we do appreciate that in general. But we're still doing the antibody testing, the rapid testing, and then the nasal swabs, of course, for any.
I know a lot of countries that are still allowing you to travel, like Jamaica, for one, where I went last year. They've changed their criteria. It used to be it could be 10 days out. Now it's 72 hours. But they will accept the rapid test instead of the was a PRC?
The PCR.
PCR test. I knew I'd get it backwards. But the PCR test, they're not really requiring that. They can do the rapid test and get the results to them.
Yeah.
But it's good that y'all are doing those.
That's more for if you come in extremely symptomatic. I mean, that PCR test is always really good, especially, that gives you, if it doesn't come back positive with COVID, the PCR testing will tell you what other, inflammatory issues you may have. If it's like an upper respiratory infection or bronchitis, something like that, it'll tell you that. So you're not just sitting there going, oh gosh, am I going to end up with COVID?
Excuse me. Now, as a family practice, excuse me, flu shots, physicals, wellness visits.
Yes. We're still doing B12 shots, so it's kind of in that season to where it's cooled down or it warms up, and people, you never know what kind of energy you have, because energy is really based on, if you're overcast, you feel a little bit more weary. So I mean, B12 shots, just people can walk in if they want to, and we'll
pop you.
B12, give you a B12 shot. They're there. Flu vaccinations, I know that has, flu is still there. People still need to be highly aware that flu is still, and
especially if you're like in a certain age group, you should get the flu shot.
Yes, and we have a flu shot for individuals that are under 65, and we have the flu shot of individuals over 65.
Okay.
It just gives you a little bit more to fight off the
What other vaccines do y'all do? Pneumonia shots? Do y'all do those yet?
We do not have those, but we do have the vaccinations for schools, like when kids are starting school, they need their vaccinations done,
Right.
like the updated ones. So we do that as well.
Tetanus?
We do not have tetanus yet. So those are things that if somebody calls and they need one or they're interested, it's not. We would just order it and have it there for you.
Okay. And we're talking about doing things for like your knees, your joints, and everything. Talk about that a little bit, if you would, Sunny.
So we have, it's a hyaluronic acid injection. It's not, a lot of people mistake it for the rooster cone injections, but this is a little different. We use something called Genvisc. It is gel based. It goes into the knee joint. So it replaces that, what I like to call, it's like a rubber on like an eraser.
Right.
You know, as you age, your joints are just wearing down, and that eraser just disappears. So the osteoarthritis causes the bone to bone and causes pain, creaking in the knees. You get up and you hear that crunching sound. That means that you're basically either bone on bone or close to bone on bone. So that gel goes in between that space, and it builds up over we say give it a good 3 to 6 months. You know, some people see relief in about a week, first injections. We've had a couple people that have come in with those walkers and have walked out with the walkers over their heads.
Wow.
And in that situation as well, while we're waiting on the process, most insurances do cover it. There's sometimes we do have to do prior authorizations, but we're doing steroid injections in the knees for temporary relief until it is covered. But we have a lot of patients, it's not extremely painful. Of course, it is an injection, but you are numbed, so we do numb.
Right.
People leave, though, with an ice pack on and barely have any pain afterwards.
No, that's awesome. Last month you were here, we were talking about cellulite, and we had a picture before and after that you had done, like the one on there's.
That's only 3 treatments.
Oh, that's after 3 treatments. Wow. Okay, that's amazing. That is absolutely amazing. Talk about those. I mean, the one on the bottom was was what, first or second treatment, and then
the one on the bottom was before any treatments, and that one was my 3rd treatment.
Oh, okay.
So I mean, women are we're so hard on ourselves already, you know, as far as weight in general. And the last thing we want to do is, even if we have a little bit of weight, or even if you don't have weight, we're still so hard on ourselves. People have cellulite, women have cellulite, whether you are a larger person, medium, or even smaller. You have women that are in the gym every day that still suffer from cellulite, and that's something that we can help fix. It's something that you do have to maintain. It does last for a good 6 months after your final treatment, though.
Wow.
So summertime is coming, ladies. Give us a call. Our prices our prices are very good for this.
Okay.
It's very reasonable.
Okay.
So yeah, I mean, we're doing things as though you give us a certain amount of referrals and get a free week treatment.
That's awesome.
A free treatment, sorry.
Okay.
So
sexual health. And we talked about this for a while. Those are dealing with ED.
yes. So that department is growing. So we're focused on ED in that right now for men. So what that does, it is a non-surgical treatment, non-invasive. We use something, it's called a Zimmer, so a Z-wave. It's an acoustic wave it targets the area of concern. And that is in any part of the body, but we're targeting a certain area, of course, for ED. So that acoustic wave is targeted, and what it does, it helps stimulate healing, and it helps stimulate blood flow in that area. And as we know, in order to get an erection, you do have to have blood flow in that area, and a constant blood flow. So this shock wave after your treatments gives you that constant blood flow. It's not something that's just going to go away after you have it done. We are, like I said, we want to fix things. So depending on what score you get when you come in and do your free consultation. So again, we are offering free consultations for that. We want to help people. We want to give you the best treatment possible. So it is anywhere between 6 treatments to 12, depending on your score. But if you get your 6th treatment and you don't feel like you're in the place that you need to be, by all means, we're going to fix your problem. Any further treatment is on us as far as the Z-Wave goes. So, but yeah, just make a phone call and
Set up an
Come on
appointment.
in, set
All
up
right.
an appointment.
Thank you so much for being with us.
Yeah,
We're out of
yes, sir.
time.
Okay.
But you know, I guess we'll see you again next month.
Yes, sir.
Find out some of the great things that y'all have going
We're
on there.
constantly adding, and once we move down to the bigger place, we'll have a lot more. We're going to get into neuropathy,
Ah.
you know, diabetic neuropathy.
Right.
So that'll be a big thing that I know a lot of people will be grateful for that to
All right.
be fixed.
All right. Sonny Elmer with Integrated Medical, Pass Road in Gulfport, soon to be on Pass Road in Biloxi. Thank you again for being with us at this time for our latest expert alert with Integrated Medical.
If you have a question for any of our experts, go to WLOX.com and click on Expert Alert. For a list of any of our upcoming experts, go to WLOX.com and click on Expert Alert.